Hey, you ready for class?
Yep.
What's wrong?
I don't know. Lately I've had a high fever, really bad headache, sensitivity to light, muscle joint.
Do you think that could just be from a migraine? I know when I have those symptoms.
I don't think so. I'm cold a lot of the time, and I've been dazed and confused lately.
You might want to go, see a doctor about that after class. But Hot Rod just got here, so hopefully you feel better. See how you feel afterwards.
Hello, class. Wah, 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 wah.
Oh my God, Becca, look at his rash. It is so pink. He looks like one of those burnt spring breakers.
But, who could know what he has?
Take him to the doctor, cause he looks like a total strawberry, Kay?
I mean, his rash, it's just so red. I can't believe it's just so red. It's like out there. I mean, gross. Look.
He must have typhus.
I am Typhus, and I can't not lie. You human beings can't deny. When I'm inside of your endothelial space, my bacteria takes its place, you get sick. Cause it's gram-negative and it has a bacillus shape. Deep in the cells you're carrying, it's there and it isn't caring. Oh baby, lice can get ya, or fleas that bit ya. My mama tried to warn me, but holy crap, this song's so corny.
Ooh, infectious feces. You say you wanna get in my skin? Well, scratch them, breathe them, and I just allowed them entry. Good sanitation, minimal exposure to lice, fleas, to prevent this bad disease. I'm tired of this disease, antibiotics are the thing. Take the average doctor and ask for that. He'll hand a script right back.
So, Typhus.
Yeah?
Typhus.
Yeah?
Have you given them the rash?
Hell yeah.
Tell them to scratch it.
Scratch it.
Scratch it.
Scratch it.
Scratch that nasty rash. Typhus is back. Typhus is back.
Wah, 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 wah. Well, that's it for today, class. Case study on Friday. See you then.
Hey, wake up, man. Class is over. Alright, seriously go see a doctor about this. Like, right now. Don't worry about the rest of your classes today, alright?
Hello there, I'm Dr. Jessica. So as we spoke earlier, you thought you might have had typhus, so what we did was we took a biopsy of your skin rash and we ran an immunohistological stain on it, and you have come back positive for epidemic typhus. But don't worry too much, because we will definitely get you treated. The treatment that we're going to put you on is 100 milligrams twice a day of doxycycline, and you're going to be on that for 5 to 7 days. Some patients may need intravenous fluids and oxygen, but we don't think that'll be necessary for you. Alright, so just so you know, because you have experienced lice, that the lice can sometimes leave infected feces, so it's probably important for you to bathe very frequently to make sure that you're getting rid of all that. Also, it's a good idea to boil your clothes or other contaminated items and to use insecticides. So do you have any other questions for me?
How did I get typhus?
Well, actually, typhus is spread from lice. So what happens is the lice bites the human, and then after sucking its blood, it defecates the highly infectious feces, and that's what has spread it. So once it bites you and it's in your body, the pathogens travel through the bloodstream and they infect the endothelium and the vascular smooth muscle cells. So to overcome these host defenses, inside the cells, the pathogen multiplies by binary fission in the cytosol. And epidemic typhus is an intracellular pathogen, and therefore it can avoid cytotoxic T cells, antibodies, and other extracellular bactericides. And the damage that it causes is that if the pathogen continued to multiply, then the host cell bursts, allowing the bacteria to spread and infect adjacent endothelial cells. The destruction of the infected cells by bacteria can lead to leakage of blood organ and tissue damage, but luckily, because you came in so early, we are able to treat this, and you should be just fine. And human-to-human transmission is rare. It's normally just straight, you get it from the lice. So now, as far as preventing this, like I said, you should, boil any clothes or anything to keep it from spreading. But also, from now on, you might want to avoid exposure to rats, fleas, and lice. Also, you should wear protective clothing and have good sanitation, and possibly use insect repellent if you're outside or you think you may have a higher risk. And it's good to also perform self-examinations after being outdoors by shaking all your clothes and making sure there's no ticks or lice. Closely check your hair and skin for small bumps, as it's important to closely examine underneath arms, breasts, behind knees, around ankles, and in the groin area, because those are really common places for ticks and fleas to hide. So other than that, do you have any questions for me?
Nope, sounds good.
All right, well, I think we're done. Thank you very much.